Good evening. Good evening. I'm sorry I was talking and my mic was off. Okay, let's start our today lecture. It is with uh, these four things we are going to discuss today. It is like first thing is drug and alcohol abuse approach. I'm discussing them together. There is a subtle difference, and we are going to discuss about it. And most of the time, we are going to spend on drug and alcohol abuse, and secondly it would be anorexia, and third it would be insomnia, and the last thing is MMSE and dementia. And these four topics are equally good topics, and these are important because they are very much coming in the exams. So give your keen attention towards that. And I'm sorry I could not provide you with the notes because actually I had a problem with my I don't know, I was making the notes, I was about to end, and there happened some problem, and it took me like in the very start I could not organize the notes in the way we used to. But I'm going to give you the notes after tomorrow or today very night in the night. I'm going to compile and going to give it to you because I have made them. I know how to compile them, just had got some problem with I don't know with Microsoft Word, and all the things were gone. I could not save them, but don't worry, I'm going to do that work again for you guys. Okay, let's start with the drug or alcohol approach. It is the same approach, trust me. There is only a little bit difference, and I'm going to discuss. Most of the time people used to teach them separately, but I'm going to teach you in a single go because I don't want extra work from your side. Okay, let's start with the drug or alcohol abuse. So if you want to memorize this mnemonic, it's okay. If you do not, doesn't matter. So first of all, the patient can reach you with any problem, I'm having a drug problem. Patient can tell you by himself, I want to leave the drug addiction. Or there's a patient who comes to you and he's alcoholic, he's taking a lot of alcohol, so you have to talk about all these things. Okay, so first of all, we will be starting with the drug approach. Okay, the drug approach, the first thing you are going to ask about which type of drug. Obviously this is very much important for you. Then you will be asking for the quantity, frequency, pattern. Here are the question: how much do you use, how often do you use? These are the common questions we ask for. Even the alcohol: how did you start using the drugs? Is there anything who forced you? Was there any particular motive you start using the drug? Okay, these are the kind of question you start asking. Then the route of administration, it is very much important. I'm going to make it red for you so that you can remember that is important. Route of administration is quite important. How do you take these drugs? It is very much important. Do you smoke them or inject them? If the patient say yes, ask about, do you share needle? If say yes, then keep on asking the question, do you know about the needle exchange program? If say no, even if he say yes, okay, then say, are you registered with the needle exchange program? These kind of questions are to be asked. If the patient say, I do inject, he can say yes, I mostly I mostly smoke. Okay, then you need to ask, do you inject? You need to ask this because sometimes maybe patient mostly smokes some drug and sometimes he's injecting the other type of drug. Do you inject? Okay, then you will be asking about the needle. So this is very much important part in this section. I'm going to point out, because never forget to ask this, because you need to answer certain question after that. Source of drug, you need to ask source of drug, from where you get the drugs and how do you buy these drugs. Okay, this is again very much important. I'm going to read it for you because it is equally important as the route of administration. With whom do you do this? If there are kids, do you do in front of kids? For example, are there any kids in your home? Do you do in front of your kids? This is the again question. And who do you do this? He will say something regarding that. Okay, then there comes a very much important questions. This is the big, actually these questions are basically approach to this question. These are the 6 questions you need to ask in any of the mnemonic for this is CAGE TW. So this is very much renowned mnemonic. You need to memorize that. CAGE TW. You need to memorize this because this is going to be like in your favor whenever you are doing this station. Maybe some of these questions you do not ask all of these questions, but never forget the route, never forget the company. Then ask about like CAGE TW. What is CAGE TW? Cutting down, annoy, guilt, G for guilt, E for eye opening. Okay, the eye opener question you will not in the drug. Only this question you will avoid. You will ask about all 3 questions. However, in the case of alcohol, you will ask this question. How you will be asking? I have like put in that way. Have you felt, this is the cutting down. Have you ever felt that you need to stop using this drug? Okay, stop using. And in the case of alcohol, have you ever thought of cutting it down? Because in the alcohol, it is important to cut down, not important to like leave it. But in the case of drug, it is important to not using, like quit. Have you ever thought of quitting it? Have you ever thought of cutting is down? This is the difference I told you I'm going to speak whenever we are discussing these together because there are only subtle differences. So important is that you need to ask, have you ever thought of cutting your alcohol down? Have you ever thought of that? So you cannot say, have you ever thought of quitting the alcohol? Because it's in our society, it's not in their society. So you need to ask cutting down for alcohol and quitting for drug. You cannot say, have you ever thought of cutting down your drug? That's not good. That's not a question you need to ask. You need to ask drug question. You need to, have you ever thought of quitting the use of drug? Okay. Annoyed question is the same. Have you ever gotten annoyed because other people are concerned about you? Okay. The otherwise is, have you ever felt guilty about using them? Because it is important. If somebody is feeling guilty, he's going to leave the drug. Otherwise, he's not feeling guilty. Why he need to leave the drug? Okay. So actually, we are by KGTW, what we are doing, what is in our mind? It is actually we are assessing the severity of his dependency regarding this. All these questions are for that. Eye opener, it is only for the alcohol, not for the drug. You will not ask about, is that the first thing you have in the morning? No, the drugs usually people do not do that. It is because but yeah, in regarding the alcohol, people start taking energy from alcohol sometime after they become alcoholic. So you need to ask this question: is this the first thing in the morning you take? It is regarding the alcohol and not for the drug. T for effect. Do you have amount? Actually, it is for the amount. It is amount or effect, whatever. Do you need to take more amount to have the same effect? Do you need to take more amount to have the same effect? So that is actually tolerance. This question is regarding the tolerance. W, withdrawal. What happens if you do not take? So why I am giving much time on this approach, KGTW, because it is the question. I want you to learn how to like memorize them. KGTW. K for cut down, A for annoy, G for guilty, E for eye opening, T for amount or effect. And what I'm assessing here, dependency, and W for withdrawal. So this is ABCD of this approach. Okay. Then any time to stop, you need to ask, do you have ever you thought of quitting this? Have you done any attempt before? Because it's not the first time you're doing this. Because, for example, if they say, yes, I have thought 2 years before, then ask question regarding that. Okay, so what plan you had at the time, and what stopped you from cutting it down? What stopped you from quitting it? Ask about those factors, because he may say, because actually I have a company, and whenever I go to the company and I start doing this again. So you need to ask these questions. Trust me, these questions are quite important. Never forget any question, because this is like you have to ask any of the alcoholic or drug addict these questions. Okay, then comes any attempt to stop. You ask red flag. Ask about what is the red flag in these. It is the depression. Can you scale mood for me? Have you ever thought of hurting anybody or hurting yourself? So these are the two red flags, because you know the people can with the drug addicts or the alcoholics can harm themselves and they can harm others. So you need to ask, these are the red flags. Okay, so background. Okay, this is again very much important. If you forget any of these questions, Famish and Cage TW are two mnemonics. Cage TW and Famish. Do not forget any of these questions. For example, the Famish, the most important thing is F. Forensic is like, I would say, because I will try to make it easy for you, I would say conviction. Convicted. Police conviction. It is, you need to ask regarding the policeman. Family, friend, finances, forensic. Forensic is false convicted. Okay. The 4F. This section is quite important. F is quite important in here. Though we are actually, what we are doing, we are now in the PMA only, family disatoli, but it is that much important. You need to ask very much question over here. For example, what? Family. Do your family know about it? The first question. Who else is in your family and are they supportive to you? And do you have friends? Do you do with your friends? Do you have other company who do not do this? So because in this section, why we are asking so many questions regarding friend and family? Because in the end, we will be needing them to support him. Okay, that's why we need to ask if he's living alone, his relation, ask about the relationship. Okay, the relationship actually I will put here, not here. Okay, because it is that much is important. This in this station you can get fail your station, just not like asking question regarding the sex and relationship. Sex and relation. These are both red, and here friend, family, and this is again like the red. You ask about what do you do for living, how do you manage your finances, is there any stress in your life? Ask all these questions. Then if the person is taking drugs, ask about the alcohol. Must ask about the alcohol. Maybe he's having the drug and he's alcoholic addict as well. Okay, so you need to rule that out. Okay, if he's taking alcohol, like he's alcoholic, you need to ask about the other drugs as well. Okay, then there comes the medical history. You need to ask a quick question regarding the medical history. Insight, Famish insight. What is his insight? What question do you can ask? Actually, we are asking inside question here as well. So you can ask a simple question. What is, how do you think about your life? Because you are actually checking his insight. How is like your life going on? Do you think that you need help in this regard? Because these are kind of questions are very much important regarding the insight. And H for hallucination and psychosis, because if the patient is having hallucination and psychosis, you cannot let the patient go in any way. Okay, if he's having the red flag or hallucination or psychosis, I would prefer this question to put in the red flag. However, because this is very renowned mnemonic, Famish and Cage TW is not our drive mnemonic. These are the very much renowned mnemonic, and you need to learn. So that's why I kept this remaining here. However, the hallucination question you can ask in the red flag, because otherwise you will not let the patient go. Then come the eyes, AIs. Anything you want to add? I for like, do you have any idea regarding your condition? Do you have any particular queries? Then if the patient, for example, if the patient comes, they say, I want to leave this, and do you need to impact all in any of these scenario, any of the scenario regarding psychiatry, there are double eyes. One eyes is for impact and concern. Oh, sorry, it is idea and concern. Other is for impact and coping. What you are doing to cope with it. Okay, you can ask this question, but it's not like red flag question. There's a chance you can forget any of these. Okay, then doing OET and then management. This is all approach. I want these things to, because you will be asking these questions, because whenever the person say I'm having drug, you will be asking this question. You will not forget how much and how you are taking all. Then ask about the route, never forget. And if we say positive for needle, talk about the needle exchange program in a very detailed way. Because in the end, if the patient say, yeah, I know about that needle exchange program, I'm registered with them. And in the management, you are saying you need to register with them, needle exchange program, and that will cut your marks because you have not asked about that. The patient is doing already, and you're talking about that, and that will like make you like more templated. Okay, so ask about the company. Do the cage TW. Never forget the famish. Famish is like social history. Famish is for the social history. This is the history. Okay, here the mnemonic. Why it is the famish? Because we have put certain new things: family, friend, finances. By any chance, are you convicted with the police? Okay, you can ask this question. By any chance, are you convicted for any charge? So you need to ask this question. Okay, now comes towards the stations. Station, the URFY, alcohol, in alcohol and abstinence misuse clinic. Alcohol and abstinence misuse clinic. 32-year-old man. So it is very important, you know, that where we are. Where we are is very much important, because you have not seen this, and in that you say, okay, I'm going to refer you to alcohol and substance misuse clinic, and you say, what? I'm here with you. So you need to see it very clearly where we are, because in our mind it is only GP and it can be emergency, nothing else. But sometimes this is something else. Here it is something else. So 32-year-old man has been using drug for a while. He come to the clinic with the intention to stopping them. Okay. Assess the patient, drug dependent, address his concern. This is all we have talked about. You will be start taking history. He's doing this kind of drugs. He's taking LSD, heroin, and sorbent. And you lived with a girlfriend and come to clinic because her girlfriend talked you to come. Okay, one thing I forget to talk about, it was sex and relation. This is very much important. Sorry, I forgot to talk about that. It is equally important. Why it is important? You need to ask, for example, who do you live with? I live with my girlfriend. Okay, do you do these kind of drug by any chance with your girlfriend? Does your girlfriend know about that you do drug? Okay, he said yes, she knows. She knows about drug. Okay, you will be asking other questions. Okay, by any chance, do you do this drug with your girlfriend? He would say yes. Okay, so you need to ask whether he's doing or not. You need to ask this question directly. How is your relationship? Are you in a stable relationship? By any chance, do you practice like casual sex? Why it is important? Because in this class, in this is very much common that they don't use. If they say yes, I have the casual relation, do you use condom? Do you use protection? Because this is equally important. If say no, okay, so there come another box should be open in your mind. Okay, which box? Then in the end you need to like ask him to bring her all the partners for the STI testing and tell your partner regarding that. Because and if he say no, okay, I have the only one relationship, that is I'm in stable relationship with my girlfriend, still you need to encourage the patient regarding asking your partner to come for to leave the drug addiction. Why? Because first, it is not like that compulsory, because in the STI scenario, if the patient say I will not ask her to come, you need to compel him, like encourage him to bring that her girlfriend for testing. Otherwise you have to contact them. But here you need not to contact her if she's not coming. You need not, but you should encourage him to like bring her girlfriend. For this it will be beneficial for you, because you both can work together. Otherwise you can relapse to that, because your girlfriend is taking drug, you are leaving the drug, and otherwise this will be of no use. So that's why the sex and the relation questions are quite important here. Never forget to ask, and don't be shy regarding asking these kind of questions, because in their society, it is very much common. They ask this question very openly. Yes, you cannot disrespect anybody, and you can signpost for that. By any chance, do you practice safe sex? You can ask in this way, but you need not to ask. I don't like that you be asking, I'm sorry, I need to ask a very personal question regarding your life. Don't signpost in that dramatic way. Like if a doctor signpost for something, it is quite a simple way to signposting. By any chance, like you can use your non-verbal clues regarding that. By any chance, do you practice safe sex? This is enough. You need not to like bring a very long and damn sorry, I need to ask a question from you. Actually, this is kind of personal question. No, don't do that. This is not like a doctor. Do not ask. No, they are not dramatic in this. The most important thing where you need to be dramatic is breaking the bad. Nothing is more dramatic than that. The thing where you need to be dramatic, yes, there you need to be dramatic because you need to show your empathy and you look like you're giving them empathy. Otherwise, you can like do a normal conversation. And second thing where you need to be a bit dramatic, but you need not to speak a lot, it is when the patient is angry. In that, you will not be like speaking anything. Do you not be dramatic? You just need to be calm and listen to the patient is talking about. It's just I'm getting out of the box and just want you to compare how you have to behave, because half of this exam is how you behave in the exam, not only what do you know about this exam, not about only the knowledge. Yes, knowledge is important, but the behavior is equally important. So this is I'm telling about the behavior which you will show in the exam room. Okay, so actually this is how you deal with the real patient. So in the real patient, you deal in this way. Okay, you already know about the needle exchange program, then you will be asking, but do not always use that. And you should ask, are you registered with that? Are you working at moment? Sometime your girlfriend. Yeah, these are the all questions we have already asked, and he is going to tell you. Okay, and in the management part, because I had the management of this in a very planned way, but I could not send you because this is the just I put the information here, but I'm going to make it in a more planned way before sending you. Okay, what is the management? Because you will be like disclosing, like Mr. You have been using hearing for the last year, because not the diagnosis is just the conversation. The management of this scenario is the conversation. Keep in mind, there is nothing management. It is all about the conversation, do's, not to do, lifestyle modification, because the management is this. No, you do not use it. You develop symptom because he may be having the agitation symptom. So that's why he has left it. So you will be talking about that. I believe that you develop the dependency. The heroin is very harmful for the health. Do you want to give up? I need to run. That you will be doing all these tests. Never forget to ask about the STI screening. Never forget to do the STI screening in this scenario. This is like very much important over here. Never forget about that. You will be telling that there are two common approaches we use to. One is detoxification and the other is in maintenance therapy. In the maintenance therapy, you give what is important in maintenance, you switch on the substitute or heroin that's less harmful. And what is that? Methadone. And in detoxification therapy, after the substitute, before you put the patient on the maintenance therapy, then you like follow by detoxification therapy. So you should tell these both to the patient. After that, what are the common side effects of the methadone? Because you need to tell them, and you need to tell them how to cope with them. And it is the constipation is very much important, feeling sick, and you need to tell how to cope with the constipation. And everybody of you know about that. Drink plenty of water, like do a fiber diet, use a fiber diet. Okay, and the patient look at the scenario. The patient is like drinking alcohol as well. This is a very much common error people do in the exam, and this is one of the commonest reason of the failure, because the patient can present you with two problems. One is grave and second is less grave, and we cannot like forget the less grave. Even he's drinking 2 to 30 unit per week, and that is more than required. That is the 14 unit is that is the recommended dose, and 2 alcohol-free days are the recommended dose. So you need to counsel regarding this to the person even. Okay. he's not alcoholic, maybe he's not alcoholic, you need to ask like some symptoms like alcoholism as well, and you will be telling that you need to manage this as well. Okay, so after I'm telling you again, because these notes I need to arrange, because I have just like put all the treatment, but the arrangement I'm going to give you in a proper notes. And okay, I'm telling you how we are going to discuss with the patient. First of all, this is like explain what is happening with the patient. Okay, the second thing, we are going to tell about the medical treatment. This is the medical treatment you will be requiring. Why? Because the heroin addict requires the medical treatment, and then you will be talking about its side effects, and you will be need to take for the very long time, and you need to tell about the alcoholism, and after that alcoholic, you will be telling about the reduced alcohol intake, and for that you need to tell about the AA group, is the Alcohol Anonymous group. You need to tell to the patient because it is important for him. Secondly, you need not talk about the CBT. Always talk about the CBT in here. Why? Because the patient need the constant inspiration to leave this. For that, the insight building is important. That's why CBT therapy is important. Then this is the particular support group, Narcotic Anonymous or Smart Recovery. This is like anonymous group for alcohol, and Narcotic Anonymous or Smart Recovery group for this. You need the family support and care. Always tell about that, and help and stay healthy regarding HIV and all STIs. And if the patient regarding the history told you about her partner, never forget about telling about the partner. Okay, this is all about this drug scenario. So the other scenario is alcohol abuse. Alcohol abuse is this is very much, this was at the time I took the exam, this was the very much common scenario which were coming in the exams. This scenario, gynecology URFY in the gynae department, 55-year-old lady in the hospital. She had hysterectomy done and she's going to be discharged. Assess the patient alcohol dependency. This is pure alcohol dependency scenario, because the patient, whenever you need to tell to the patient, because this is important. First of all, how this is all about his because you will memorize this information as well. The information is that the patient is resistant to leave. Actually, this is the other patient was not resistant. The other patient wanted to leave. That this patient is resistant. When you ask about, do you get annoyed when other talk about you or are concerned about it? She says, yes, I'm getting annoyed because you're talking about it. I don't want to leave because alcohol gives me pleasant effect. Actually, she's a bar attendant, and in the bar, she says, when like I cheer up with my friends, I like this because when I drink alcohol, it is actually my job get boosted because of that. I can like talk with the customer, and actually she will make it difficult for you. This is a difficult scenario because the patient is resistant. Always the resistant cases are difficult. The patient is not cooperating. So we cannot like offend the patient. What should be in our mind, we need to keep the ball rolling in a very cool, in a very calm way, and we need to keep the patient in an attractive way. In the end, don't worry if the patient is not like in the end, in these kind of scenarios, when you are in the exam, like in the exam, you get worried because the patient is not listening to you, and you say, I've talked in 3-way, in the 4-way, in 2-way, but the patient is not listening to me. There must be something, and nothing is wrong with that. Your work is to keep the ball rolling. Talk to the patient. If he's not convinced, if I make my mind, you cannot convince me. Nobody can convince me. Okay. So if the patient has made his mind, you cannot convince her. So it's not your fault. Okay. Just keep talking. Everything is same. You will be asking the same eye opener. You will be asking this question in here, and the other thing regarding what you will be asking about, you will asking all these questions. You will not asking about the route of administration, because alcohol has the only one route of administration. We cannot inject alcohol because we cannot be so stupid that asking what is the route of take. It is the only one route. And second thing, after that, asking all of the alcohol question, you will be asking about the drug. Do you take any recreational drug along with that? This is a compulsory question, because the person is almost alcoholic or alcoholic. You need to ask this question. Okay. The other thing is same, and here you will be asking about not to leaving. I'm repeating, smoking is with quitting, but alcohol is cutting down. Never say quit alcohol, say cutting down. Okay. Similarly, drug is quit. Everything will be staying the same, nothing will change. You will be asking all these questions, but in all that intensity, like, because um, yeah, the area of famish is more prominent in the drug. You will be asking this question, but you cannot stay here for very long. But in the drug section, you can stay in the famish area for very long, because this is very much important over here. It is important as well, but the difference should be in your mind. Okay. This is, we have talked about this scenario. Okay, here regarding the treatment, I should tell you that I will be arranging it for you, but there are like 4 things that should be in your mind while managing the patient with alcohol. What are these? First thing, after exploring, after telling that you are taking very long, first thing that should come in your mind: cutting down. First advice, cutting down. First advice, cutting down. Second advice, medical treatment. Third advice, psychological therapy. What I would say psychological therapy, because it will include CBD, cognitive behavioral therapy, talking therapy. It will include talking about the AA group, anonymous alcohol group. You need to talk about the family sport. This is all psychological support. So for you guys, I am going to like cutting down. The first thing is cutting down. First thing, you will be talking about the cutting it down. The patient will say in that way, okay, no doc, I cannot do that. So after that, what question should come in your mind? Anybody. So I want your involvement. I want you to get like you people should be not be sleeping. If the patient say I will not, I cannot, because it's my work, it augment my work. What question should you, like, you can open your mic and tell, then how you will conversate, because it will come over here. It's not like this is obvious. They will, in this scenario, it will, she will say that I cannot cut down. How will you like and talk to the patient? How will you open your conversation? Anybody? Nobody wants to reply. Okay, it's very simple. You need to explore. Okay, could you please tell me what made you to think in this way? Yeah, why? What is the reason that you don't want to cut down? She will say, okay, this and that. Do you then what do you say? Do you have any idea that if you do not cut your alcohol down, what its effect might be? So ask about, tell about the, ask about the hazards. Check her understanding regarding not cutting down, regarding the cutting down. Okay, so she will say, I understand that, I know that it can affect me, like, but still I am not ready to do that. I can understand that your pattern of think is right at your place, but let me tell you that if you do not cut your alcohol down, it can affect you physically, mentally, in your health, in your healthy way, in your health in many ways. Okay, so open that conversation without having in mind that my time is running down, because there is no other management. This is the management. There is no other management. The other management is like secondary. The first manage is you have to convince the patient for cutting the alcohol down. Okay. The second thing, medical. Okay. Have you ever tried anything, any medical therapy for that, cutting it down? Okay. There are certain medication. For example, there are medication, chlordiazepoxide, and then the other thing is lifestyle. Sorry, it is psychological. Psychological. Never forget to tell in the psychological 3 things. 1, CBT. 2nd, AA group. 3rd, self, family and friend support. Okay. And the 4th one is lifestyle. And lifestyle, because if there is wrong lifestyle and she need to change it. And last thing is safety netting. Safety netting, what you can do similar. Self-harm, any problem with the self-harm, harming other, any thought regarding that, any hallucination, you should come. Okay, this is the same. So this is written in a very like a bit haphazard way. So I'm going to in both of these scenarios, DVLA, it should be one of your concern, because the patient is driving. What you do for a living? I am a taxi driver. How you came? I came on, I'm driving my taxi. But otherwise she can say I came on, who brought you today? I came alone. Okay. How you came? I came by driving. So the patient ask, tell about the DVLA. The DVLA is in the lifestyle modification. Here the lifestyle modification you will be talking about DVLA. Why? Because in the patient has impaired problems, you need to tell the patient that you should not be driving until you inform the DVLA and have talked to them about this. So never forget the DVLA in these scenarios. So this is all we have talked already about. I'm just going to arrange this management for you people, and then I'm going to talk. I'm going to send it to you, because it was already arranged. However, there was a problem. Any question? Because this is a very separate approach, very different approach. So anything you want to talk about that, like any questions, because otherwise we are going to jump to the anorexia approach. Anything that is not good, well understood, and or you want me to repeat, because this is important. Most of the time I tell you, the people forget these questions I have already highlighted in the history and route of administration, company, and these classical cage TW dependencies question, famish question. Here the most of the time people forget to ask about the question, and the most important in the famish, they ask, don't ask about the sex and the relationship, because these are the important one. And similarly, family, friend, finances, and forensics. This is the approach. If you learn, if you know about this approach, this approach is a bit similar, but there are a little bit differences I have already talked about. If you want to ask any question, if anything which is not well understood, we can talk about. Okay, I assume that if you're not asking, that you know about that, that you have learned. So next thing is next approach is anorexia. Next approach is anorexia. Anorexia is again very much important scenario, and this is one of the common scenario which is asked. So I made a very good mnemonic for you so that you can like memorize it, scoff, like yeah, you need to answer general physical examination, nothing else. You need to ask, you will do all OET, but it is in a very general way. I'm not talking about the thing that I understand that like that you know about that. For example, you will be asking, I need to take your observations. No need to even say anything more about that, because okay, it's understood that the observation will be like all right. I need to take the observation, but it is not in that scenario that you are going to discharge a patient. You are telling about the observation. No, the other patient, you are going to say observation, I need to do the general physical examination. Okay, but this is just to say that this is not that much important in here. Okay, in anorexia scenario, yes, these things are important, but in the alcohol dependency scenario, these are not that important. So for us, it is important to know about what is our like main focus area. Other thing we are talking about, and we have written in, you are going to talk about that. For us to tell you is very much important that you memorize the most important area. That should never be forgotten. Other thing, okay, if I get memorized, in the exam, it's good. But if do not, I will not get failed because of that. But the things we are talking about, the red things, red flags, if you are not talking about, and trust me, the passing this station will be difficult. Okay. Now we come towards the anorexia scenario. The anorexia, the first thing I want you to memorize is this mnemonic. This is scarf. Scarf is the Muslim thing. Muslim woman wear scarf. SCAF. Scarf. So for us is scarf. SCOF. Scarf body model clothes. Scarf family. Sorry, family. Scarf family body model clothes. So scarf for the Muslim family, it is like their model body cloth. So just remember this mnemonic. This mnemonic going to help you a lot. Like scarf family body model cloth. Okay. As for, do you induce vomiting after eating? Okay, I want you to memorize this thing. Otherwise, how we will approach this, we will be discussing in the scenario. I want you to memorize this approach for first, okay? Then we will be discussing in the scenario. It's not the first thing we are going to ask. Definitely, we are explore other things. Then, but this is a set of questions you should never forget. Do you induce vomiting after eating? This is what for bulimia nervosa. Do you worry you have lost control over how much you eat? So this is, we are checking her psyche regarding eating. Have you recently lost more than 1 stone in 3-month period? It is O for 1 stone. Okay. O for 1 stone. C for control. S for self-vomiting, S for self-induced vomiting. So this was the good question. I always keep the approach like smart, but S for self-vomiting. Okay, F for, do you believe you are fat when the others say you are thin? Fat, F for fat, F for fat, other F for food dominate. Again, would you say the food dominate your life? We are checking her belief regarding the, actually here we are checking her beliefs and we are checking certain her behaviors. Okay, this is for the family. What do your family and friends say about you? They're like thought about your image, body image. How do you see yourself in a mirror? It is like her own image. Role model. Do you have any role model? What type of clothes do you wear? So these are the questions you need to ask any person with anorexia nervosa. So what is the mnemonic? Scarf family body model cloth. Because the scarf is the family model cloth for the Muslims. Okay. Then after asking these questions, these are the symptomatic questions you need to ask any person with anorexia nervosa, because we need to learn about the severity. No, 1 stone is not 1 kg. It is almost 3. I don't remember. You can check, but it is 4 to 5 kg. I think you can Google it, but it is not 1 kg. It is like 4 to 5 kg. I think. But I'm not, I do not exactly remember. But it is a lot of weight. It is not like 1 kg. Okay, you will be asking these kind of questions: lightheadedness and dizziness, hair loss, dry skin, bone pain. Why you will be asking this question? You want to assess the symptom, because the treatment, the patient is having these kind of symptoms. We need to admit the patient. If the patient is symptomatic, we need to admit the patient. If the patient is having below 15 BMI, we need to admit the patient. Where? Under the medical. Because, okay, keep in mind, like in the last scenario, we will be discussing regarding in the suicide, medical and psychological treatment. In anorexia patient is the medical patient. It is the first medical, then psychological patient. So never think is only as a psychological patient. It is 6 kg. Okay. Red flag. Always ask about these symptoms. You can ask 1 or 2 symptoms more. Bone pain is for the osteoporosis. Then ask about the red flags. any weight loss, patient is already having the weight loss, you will not be asking this stupid question if the patient is like having the weight loss, telling you. So this, any lump bump in your body, low mood, suicidal thoughts, these are the red flags. Okay, then we will be completing our Holy Family Desatoli. In Holy Family Desatoli, the what is important for us is diet and exercise. These are the very much important question you need to ask. How is your appetite? What do you need? Breakfast, lunch, dinner? Do you have habit of binge eating? Exercise, how much frequent? Sometimes people is eating like not less, but he's doing a lot of exercise, he can be anorexic, because anorexia is not with the eating, it is actually with the imaging. It is the false belief. Anorexia is false belief, not less eating. If I'm not eating good, it's not anorexic. Anorexia is with the false belief. That's why we asked a lot of questions. Okay, then we will not make a judgment that is anorexic. We will be asking all the medical questions, because even asking these questions in here, asking these medical questions are quite important. Do you use any medication to reduce the weight or hunger? This is again very much important. Or ask about the laxative use. Laxative should be asked over here, because why? Because are you use any vomiting for inducing diarrhea, vomiting? You need to ask this question as well. Then all these medication, ask about the coughing. One question is enough for each disease. Tuberculosis, malabsorption, you will ask about the diarrhea, asking about systemic review, hyperthyroidism, diabetes, depression. Never forget to ask one question, single question for them. In any way, I'm going to arrange them in a very good way and will be sending to you. Then never forget to ask about the menstruation, because if you do not ask a question of menstrual history to the patient with anorexia, you will not fail the station, but you will be deducted at least 1 mark only for not asking this question. They will deduct 1 mark, because this is very much important, because it has very strong association with anorexia. So you will be asking this question. So if the patient is 16 years, you cannot tell me about your, you cannot ask about that. Have you started menstruation? You will be asking this question first. When were your last menstrual period? Is that the regular one? How much days you believe? You will be asking all these questions. Okay. Then you will be asking AIC, for anything you want to add, idea, any concern, I for impact on your life, everyday activity, and C for have you done anything? Because he has not done anything, because most of the time the patient say, I'm okay, I do not have any problem regarding my disease. Okay. The other thing, you will be here, you will be asking I will like to take your, because it is a medical condition as well. Keep in mind, it is a medical condition as well. It's not only a psychological condition, because you need to manage it medically and psychologically. So you need to ask this question: general physical examination, observation, you will say, and take blood pressure, because normally they are hypertensive. Anorexic patient are hypertensive. You need to ask this question. Need to take the blood pressure, and then you will tell examination, GP, systemic examination, and BMI. Never forget to tell the BMI, because somebody BMI is not given. They will give you BMI. Her BMI is 14.5. So this will affect your management. Her BMI is 19. So you will not say use anorexia, because if the person is below 17.5, it's not anorexic. There will be a chaperone. You will be telling all this to the patient. You will be doing all the tests: blood sugar level, ECG, a thyroid test, TSH level. You will be doing all these tests to the patient. Okay, this is what approach of the anorexia is. So we are going to discuss 2 stations regarding the anorexia. The first is avoid 15-year-old in the GP. Where GP? 15, because for example, you need to refer the patient to. There are 2 places where you should refer. One is medical unit. The other is under eating disorder clinic. If you are in the eating disorder clinic, so you cannot send the patient to the eating disorder clinic. Okay. So again, you need to know where it is. It is in the GP. If you can come with our mother, mom has the concern, assess the patient, address the concern. So mother say, my daughter is looking thinner than before, she's losing weight. So here, just for this scenario, one very much important thing I want to tell you regarding this, that you have in your mind only, there is only one person I need to talk. There are certain scenarios, there are two persons. One is this, one is, what I do remember, that mother and father are there regarding the breaking the bed, the patient has got the accident, the boy has got the accident. Here, only again two-person. Examiner is separate and two-person is front of you. So you need to talk to both of them. So first you need to talk to the mother. Then okay, can you please excuse me? I can so that I can talk to your daughter directly. Then you will be coming towards the daughter. And in other scenario, I'm talking about that in an emergency scenario, the patient, they had brought some like kid with accident. I think Dr. Adil has taught you that station. In that, you need to interact both of them at once. Like you then, okay, the mother is interactive, more interactive because she's more worried. So you need to, but here you need to ask, take the concern from the mother, and you need to talk to the daughter directly. Not you will be asking question from mother. You need to talk to the daughter directly, okay? But first, before starting the conversation, when the mother says, okay, I came with the concern that is this, so you need to talk to the mother, and then you will say, okay, pardon, now I need to talk Lisa, because first you will check the relation, or you will like start all the protocol. You need to check the protocol, how you are related to the Lisa. She say, I'm mother to her, okay, tell me what is worrying you. She will be saying that all this thing to you. Okay, is that fine? I should talk to your daughter regarding her health. Then you will be talking to the daughter and taking all the history. Okay, this is just not to get confused when you are in the exam. Examiner will mention BMI is 17 when you will say I need to take the BMI. If you will not say the BMI, he will ignore it and he will deduct your marks. The second thing is you are MY2 in the psychiatry department. 18-year-old has come to brought by her mother. Take the focus is to discuss the management. BMI is again 17. So two scenarios, not BMI below the 15. So patient, you have been referred by the GP. Mom has brought in the hospital. So these are the all concerns. You will be asking all those questions. You can just give it a read. All these answers are fitting in your approach. Anything, she exercise 3 hours in a day. Look at this. If you are not asked about the exercise, she's doing exercise 3 hours a day. That's not normal. And maybe she's still, what type of exercise? She said, I do a very strenuous exercise. Like I do 1 hour cardio. Maybe she's saying that. You may have more water in your diet. That is typical anorexia nervosa scenario, okay? Greet both and like introduce yourself, talk to the mother, then talk to the, after that talk about like weight loss, and if she's having a weight loss, ask about the weight loss, how much weight loss, since how long period, is the intentional, or like ask all these questions, okay? Because if it is not the intentional, that there could be something else. So after that, we will follow our total approach. We have talked about the anorexia approach, this approach. Before, after greeting, starting the conversation, we will be like asking about the weight loss history. And because the mother is concerned, you can ask a few questions regarding the weight loss to the mother, because the daughter is not going to tell you about the weight loss, because she say, yeah, my weight is okay. My weight is like 39. I should be 35. So she can tell you, and how can you take the history of weight loss, because she's saying my weight, I am not losing the weight. So this history you need to take from the mother. So first take this history from the mother, then go to the daughter and talk about that to the daughter. Take this history, this particular approach, like SCOF family model body model cloth, SCOF family body model cloth, and ask about the symptom, do the red flags, then complete your PMA Holy Family Desatoli, in which you will be talking about the diet and exercise more. Then you will be talking about the medical problem, and you will be talking one question. This is like a DD. here the medical problem, because she's having no DD other than that, you are asking these so many medical problems. Why? Because you are ruling out the other diseases. That's kind of your DD here. Then talk about the menstrual history. Then in here, OET is important. You cannot ignore OET here. No, OET is important here. Quite important. That is a medical condition. Okay, comes towards the management. So I want to tell you about the management thing. First of all, you need to assess what kind of symptom patient is having. For example, if the patient is having any symptoms, like any of the symptoms we have talked about, any blood pressure is low, any danger sign, anything, you need to get the patient admitted. First thing, where? Under the medical team. You need to get the patient admitted. If her BMI is very low, like 15, you need to get the patient admitted, get the advanced treatment. Okay, one thing, okay, I want to add one thing here in this approach, just came into my mind, just that is urea and electrolyte. This you cannot forget. Yes, if the patient is, but here we have the 17-year-old. Both our patient are 70-year-old, but if the patient is 18-year-old, it is the patient you need to talk about. And one thing, actually, this is a gray area. I should tell you why it is gray area, because actually you need not to ask, actually, even if but first of all, they are not going to confuse you that much, because this is a gray area. Why it is the gray area? Because in the patients where the conscious level is impaired, their belief system is impaired. For example, if the patient is like 20-year-old and he is having hallucination, do we ask the patient, can he talk to your mother? We do not. Actually, because why? Because it's the belief, her conscious levels is impaired. We do not need any permission. But here it is the gray area. Here we can talk. Why? Because that's why they have put both of the scenario with the 17-year-old. No scenario is with the 18-year-old. Because if the patient is 18 or 19-year-old, this is absolutely a gray area. Why? Because the patient is having belief that I am all right, no problem is that, having BMI of 35, and she do not want to eat, and who is going to take decision? It is her parents who is going to take the decision. It can be her husband. Somebody need to take the decision, because this is not the confidentiality scenario. Actually, in this, we can talk. Answer is we can talk. We need not any permission. Because, but they are not, I don't think so. They are going to keep us confused in this way. Because both scenario is the 15-year-old, another one is 17-year-old. It's 18-year-old. We do not need to take permission even then. Okay, we were talking about its management. The first management is what? Medical therapy. If the patient do not require the medical therapy, where you are going to refer the patient? Eating disorder unit. Eating disorder unit, where they are going to do a very complete assessment. There you will be seen by the multidisciplinary top, and they are going, okay, then what you need, because your work is to send for the eating disorder, and there they are going to involve other who you need to tell, because this you can be at the eating disorder unit, however you can be at the GP, because both scenarios are there. If you are in the GP, you need to tell, I'm going to refer you eating disorder unit. And you first of all, you need to disclose the diagnosis that you are having anorexia nervosa. This, what it is, you need to exactly, it's a disorder in which the person may have the false belief that his weight is not all right, and you, because of you are having this symptom, and you are having certain like symptoms as well. Okay, you will involve your seniors. For that, I will be involved my senior, because this is a serious condition. I will involve my senior regarding the management, and I am going. We are going to refer you to where? Eating disorder unit. And if you are in the eating disorder unit, we are going to. I will going to involve the seniors, and we are going to manage you involving the multidisciplinary team. What is that multidisciplinary team? One is like psychologist. Psychologist, what going to do? CBT. And one more medical team. We will be requiring to see your electrolyte, and we will be correcting your electrolyte balance as well. And you need to involve the support of your like family and friend. You will be asking all the questions regarding the family and friends. And after that, you will need to keep the food diary as well. And you will be like giving the leaflets for the healthy diet to this patient. So this is otherwise, if you ask all of these questions, the patient will have some concern. The patient will be maybe resistant over here. What will be the resistant? I don't think so. I am having this. Mother can say, I don't think so. My daughter is having this, like this. Mother will not agree with the diagnosis. I don't think so. The daughter has mental disorder. Ask her same. Whenever the patient disagree you, always ask this question first. Okay, why do you think in this way? Why do you think that it can't be this? Okay, then because she's saying she is doing well in the school, I do not think she has got any problem. Explain the mother. It may be very early stage, but the condition can get worse in the future. Okay. You can offer a sick note if the patient is not well. The safety netting is again for the shortness of breath, chest pain, and low mood, and for the suicidal thoughts. Look at this. If the GP patient is vitally stable, refer to unstable, refer to the hospital immediately. This is immediate referral if the patient is unstable. What is unstable? Low blood pressure. If the patient in the hospital, patient is vitally, admit under the medical unit. If you are in hospital, then you will admit. If you are in the GP, then you will send to the hospital. Okay. If you are in hospital, patient is vitally stable but having a suicidal thought, admit under the psychiatric department. This is different because then suicidal thought is psychiatric department. Here you need a medical treatment. That's it. This is all about eating. Then there is a scenario that is the bulimia nervosa scenario. And in the bulimia, because the bulimia nervosa is the variant actually of eating disorder that is less potent, that is less dangerous. Yeah. And in the examination of both, nothing should be changed. In the GP, for example, you are doing the GP examination, mention the examination of hands and mouth. This is important. You will mention these two examinations. Examination of hand and mouth. Why? To rule out the patient is having, because in the mouth, what you are going to see, caries, any caries, because if the self-induced vomiting, that can cause so you will say that. For that, the examiner should know that you have very deep understanding regarding this disorder, because you cannot assume, even this is not about the anorexia nervosa patient cannot like do this. He can do this. This is, I don't know from where this belief comes that the person who is doing this self-induced vomiting is an bulimia nervosa. No, bulimia nervosa actually his BMI is stable most of the time, and second thing is he is eating but he's vomiting. This patient, the patient with anorexia nervosa, can be less eating but vomiting and doing a lot of exercise. Actually, bulimic are not that kind of, they do not need any admission. They are the psychological patient, do not need any like medical admissions. And the medical treatment is, his treatment is the psychological one. Bulimic patient have the treatment only the psychological one. It can be antidepressant, that's the psychological treatment. It can be CBT, that is the psychological treatment. These patients require the only difference is the management a little bit. Otherwise, everything is the same. You will be talking about his belief. You will be correcting his belief. Anorexia and bulimic, there is no such difference, large difference. Only the difference is with the severity and belief and their habits. Because both of them can have a belief that I should be slim. This is normal. Both of them can have a role model. This is normal. But the problem is that the bulimic patient eat but vomit, and they can use laxative, not only vomit, they can use laxative. However, the patient with anorexia nervosa, they are severe and they eat less, do a lot of exercise, and they can vomit and they can use laxative as well. I think I have cleared this concept of yours, that what is the difference and what will be the difference regarding the management in this patient. You will not be doing the medical admission, and their treatment will be involving the CBT, their treatment, and you will not be, you can refer this patient to the eating disorder clinic. You will refer this and you will be doing the psychological treatment, and that is CBT, that is a support group, and that is antidepressant. You can give antidepressant to the patient. Okay, any question regarding anorexia nervosa and eating disorder? We have like talked about two approaches. One is alcohol and drug dependency. The second one approach is anorexia eating disorder approach, anorexia nervosa. Any questions? Then we are going to jump towards the insomnia. That is the easy one. Insomnia is the easy one. Any question? Okay. Then let's move towards the insomnia scenario. Okay, one question came. Okay, and one very important question came, and that is no, sir. Okay, that is even a good question. Okay, the next approach is insomnia. Insomnia approach, we are going to discuss the approach. Let me like put the scenario in your mind first, then we are going to discuss the approach. You are FY2 in GP, 60-year-old lady come with non-urgent appointment. She had rheumatoid arthritis, taking methotrexate, paracetamol, folic acid. Assess the patient. What brought you here? I am difficulty sleeping for the last 3 months. You ask the patient, what brought you here today? I am problem with the sleeping. So this will be what the patient will say. So here the approach will come. The first question you will ask to any patient talking about the sleeping is, do you have problem with going to sleep or problem while sleeping? This is very much important, because a patient can have the like sleep apnea. First of all, before asking any other question, you need to clarify, I have a pain. Where? Okay, is there in the chest? Where? Left side. So first we identify the problem. So what brought you here today? I have a sleeping problem. Okay, could you please tell me, do you have a problem going to sleep or while sleeping? So this will classify your questions. Okay, this will give you a lot of information. Okay, here we go. Regarding the approach, you need to like ask or tupa of like sleeping problem. Since how long you have been sleeping? Sleeping problem, is that getting worsened with the time? You just ask 1, 2, 3 questions, not more than that. Then detail history of sleeping. So this is ABCD of sleeping problem. This is ABCD of sleeping problem. I have added like 6 questions more. I am going to talk. First of all, how long have not been sleeping well? Anything do you think that causing this? Has this happened before? No need to ask this question. When you go to bed, after how many minutes do you normally fall asleep? How many hours do you sleep continuously? When you wake up in the morning, do you feel, how do you feel? Do you feel refreshed? Are you tired whole of the day? Because you are asking the question regarding the sleeping, and you are asking the question regarding the sleep apnea as well. These two diseases, whenever the sleeping problem should be in your mind, so that you can ask all of these questions. Any nap during the day? How do you, how is your sleeping environment? Is your room comfortable? Noise, ask about the noise. Okay, the one thing, always ask this question. This is very much important question. This question is, never forget to ask this question. And what it is, what do you do? What do you do just before going to sleep? So don't assume that, just a minute. My screen is shared. Can you see my screen? Is my screen shared with you guys? And since how long the screen is not shared? Oh, okay. Okay, got it. Okay. Okay. So this question is very much important in here. Never forget to ask this question and ask more question even for that. What question? Do you use mobile? Because this is very much common problem people used to have these days. Ask about, do you watch any movie? Do you play any game, video game? Like, do you eat? Do you drink coffee? Ask particular question before going to the sleep. Because this is when, before going to sleep, what do you do? Ask particular question. Do you use Facebook? Do you use social media? Any other social media? Do you like scroll the screen? Because this is a very much common problem. We need to explore that. So we need to ask these two questions. But do you sleep? How is your sleeping environment? Comfortable? Any noise around? And any light, any lighting problem? And what is the temperature of your room? You need to ask the environment, because all these questions are like not specific questions. These are the questions in spectrum. Why? Because in the end, when you are going to talk about the management, these are the particular thing you are going to address, because the patient is going to have nothing and just these problems, for example. So you need to address them. Okay. Then asking all these questions, then you will, this is the approach, this is the simple approach. Then you will be doing the DDs. Stress, depression, always top. Stress, depression, I will say depression in the top. Always ask. In here you will be asking the question while doing this, always asking the question while you are dealing with the detail of sleep history, you will be asking even the question, do you get up early in the morning? Why? Because in the depression patient, they get up early in the morning. They go to the sleep late and they get up early in the morning. The patient has had insomnia because of depression. You need to ask the question regarding the depression. There is a depression scenario in which patient come with sleep problem, and he ends up, this was the scenario, it came in my final exam. In the end, he is having depression, and I got not very good score in this. I passed this exam. I tell you that what why did I got less marks in management thing. Why? Because it was a sleeping problem. I diagnosed the depression. I could manage the depression. I could correlate it with the depression, but he needed to ask me what you are going to with the sleep, because he came with the problem of sleep and I could not address his sleep in a good way. I just passed this station. That's why I'm going to tell you, in this kind of scenario, what you need to do is you need to address both of the things. For example, the patient is having sleeping problem and it is due to depression. So you will be dealing with the depression as well. You will be dealing with the sleep as well, because the sleeping is problem is immediate concern and underlying pathology is depression. So you will be dealing with both of them. Okay. So in DD, you will be asking the mood regarding the depression question. You will be asking about the PSD, all the hypothyroidism, chronic pain, any chronic pain. This is very much important question, because this is the people ask all of these questions. Do not ask this question any medication, because sometimes there are certain side effects of the medication, alcohol, recreational drug, red flag, suicidal thoughts, and you will be completing your PMA Holy Family. Desert why? Because in this kind of scenario, sometimes there is no obvious cause, only says, yes, my mom had the same problem, because this is sometimes unknown region, because the sleeping problem can be because of the any, do not have any problem. The only problem is his mother has the same problem. Why? Because most of the time insomnia has no cause, no certain cause, but still you offer some sleep hygienes. Okay. So here you will be asking the question. These two questions are regarding the sleep hygiene. I am ruling out the sleep hygiene. I'm telling you, I'm going to arrange it in a very good way, so that it will be in a very good way to you. This is just the raw material I was working on, and my after 4 hours working, it was gone, and then I could like make up to this. But I'm going to like arrange it in a good way for you guys. And after that, you will be doing the systemic examination. You will be completing all this. And management, obviously, management will be what you have told me. This is called insomnia. This means you're having the difficulty. Then there will be must have some causes, some slight hygiene. You will be talking about that. And then you will be running some tests. Insomnia can get better by changing the sleep habits. You will be talking about do's and not do. What are they? They are lifestyle modification. From where you get, you have asked about the sleep hygiene. You will maintain the sleep hygiene. Patient will ask it. There are two scenarios. One we have already discussed in the depression. That's another. That's not depression scenario. That is particularly sleep scenario, sleeping problem scenario. In this, it is the first result. Is not having lifestyle modification, so you will not prescribe any medication. Patient will ask about, are you going to give me some medication? So you will start from here. Okay, I'm going to cut it for you. Cut, and I am going to put it here. So you will say, right now you do not need any medication, because you need some lifestyle modification and CBT. You will offer CBT as well. And if after this will not be beneficial for you, we will prescribe you some medication for very short time. That would be because it caused dependency for a very long time. Okay, the safety netting is not this. Its safety netting would be, what would be safety netting? Anybody can add. You are not interacting today. This is not good. What would be the safety netting of this problem, sleeping problem? What would be the safety netting? Anybody? So no way you are going to interact today. It's the only I should speak, and trust me, I cannot take this exam as part of yours, that I can say that I can go and give this exam. It are you who need to take this test, and it are you who need to participate. Leaflets, you will provide the leaflet over here, and you will be do safety netting, and safety netting is for agitation and suicidal thoughts and self-harm. Why? You have you seen that the safety netting in the scenario regarding this psychiatry scenario, it is most of the time it is the same. Okay, it is self-harm. And the other scenario is presented with the concern, talk to the patient. Okay, this and that scenario are the similar. The only problem is in this scenario and the other scenario is that okay, the only problem is that the patient is asking you for the sleeping pills. The one problem is that the patient is asking for the sleeping pills, and other patient might have a belief that the marijuana or like any alcoholic thing that help me in sleeping. The patient can have this false belief, and this is very common false belief in the society. So you need to break that false belief over here. Even alcohol intake and marijuana, any of these, they do not help in sleeping. They cause like sleeping disturbance. So how you will answer this question? Other thing we have already talked about. You will answer this question in the way, okay, I respect your opinion, but let me tell you, for the short period of time, these things like marijuana or alcohol can give you a false a false effect of well-being, and you feel that this thing is helping. However, in the medical, it is medically proven, it is scientifically proven that it do not help in sleep, or it does not like help in sleep. It is more harmful for your sleep and for your health as well. So you need to break their false belief in this way. Okay. Other thing, everything is same. As insomnia is due to marijuana, it can affect your sleep cycle. Why marijuana or alcohol do the sleep? Actually, they both of them, they interfere with the REM sleep. You're not going to talk about that. I'm just telling you, they are like interfering with the REM sleep. They decrease the REM sleep. Because the REM sleep is good for sleep hygiene. This is to make you feel fresh. So they decreases the the REM sleep. It also has some other effect on the health. You are going to talk about that. Okay. So what you are going to offer here, again, you are going to offer the CBT. You are going to offer the same lifestyle modifications. You are going to, but I'm repeating again, never forget to ask about the pain and long-term medical condition in the insomnia scenarios. Okay. Can you give me long-term pills? No, you cannot give the long-term pills. You know why. I do not need to explain, because it causes dependency. Okay, this is our last scenario, that is dementia and mini mental scoring. That's similar. So most of the people find mini mental scoring quite difficult. You need to practice it. You can practice it. You need to practice it, because most of the people find it quite difficult. We have worked on it, and we have made it like easy for you. 8, 11, 10, 11, 9. So learn this scoring first. Learn this scoring. I'm going to give you a very better version of this. So there are 3, we have divided the question. You need to ask how many questions you need to score it out of 30. There are separate score for each act. Okay. The first, you need to ask 10 questions. How many questions? 10 questions. They are arranged 10 score for the first go. 10 questions. Which question? First time, 5 questions for place. You will start from the above, from the bigger level. Year, season, month, day, date. 5 questions. Each score for each mark. And you will have pen in with you and like paper with you. You will be asking these questions. What year it is, what season it is, asking about the 5 questions, and doing the scoring, doing the tick with it. Okay. Then you will be asking about the place, 5 questions. Country, county. County means state. County for them, county is state, like province. It's province to them. Country, county, city, building, flow. 5 questions. Okay. 10. How many score? 10 out of 10. Okay. Then the next section. The next section is registration. There are 3 subcategory. This is easy question again. The fourth question, the fourth part is a bit difficult. First 2 are easy. Registration, and then is recall. Registration and recall are the same. I'm going to tell you, but you will not change the sequence. Why? I just tell you. Registration. You will ask the patient to repeat this behind me. Apple penny table. Apple penny table. Repeat. Can you please repeat it behind me? Apple penny table. You will say apple penny table. 3 marks. He will say apple penny, not table. 2 marks. Okay. You will, if he is not repeating, you will do the 5 attempts. But in generally they do it. Okay, they are not repeating, you will do the 5 attempts. How many attempts? 5 attempts. In 5 attempts he is saying one time apple penny table, 3 score. Okay. Second is attention, 5 score for attention. Doing a single act will carry 5 marks. How? You will say, can you spell the word for me? WORLD. Can you spell the word? This is a bit too difficult to say because the other is word. This is the word, and I don't know how to say. Can you spell? Don't say word. Word. Can you spell it for me? Can you spell word for me? Okay, he first asked about, can you spell? He say, okay, yes, WORLD, word. Now say, can you spell that backward for me? Because the saying word in another way carry no marks, but you need to say how DLROW. If we say in the similar fashion, that is 5. If he's not like making any mistake, every mistake, for example, he say DLOWR, 2 score, because you have to see its sequence and word, both. It should be in your attention. I know it is a bit difficult, but when you like start practicing it, it will be quite easy for you. It is coming, but sometimes it's very less likely coming, but we cannot leave it because it is coming. Recall. What is recall? Whenever you will say registration, on the registration you will say, can you say apple penny table for me? Yes, apple penny table. Okay, you need to memorize it. I will ask that again. Okay, apple penny table. Okay, that's it. Here you will ask, I have asked you to repeat some words for me. Please repeat it for me. So he will say apple penny table. So 3 marks. So still here 21 marks has gone, and this is a bit easy. Other is also easy. People just find like not get better explanation how to do that. That's why it's quite difficult. Then it is the language part. In the language part, it is the 9 score. Language and one is doing. It's not only language part. Actually, it's not language part. It is multiple task part. So you need to ask regarding the tasks. What task? First task is object identification. Show the 2 object. Piece of paper, what it is called, the piece of pen, what it is called, because it will be over there. And say it's paper, it's pen. So object identification carry 2 marks. You will show 2 object and he will tell what it is, 2 marks. Then repeat the phrase for me. Okay. And then you will say no ifs and buts. You will say this, just memorize this. Please repeat this phrase for me. No ifs or buts. He will say no ifs and buts, 1 mark. Okay. 2 marks for object identification. Repeat phrase, 1 mark. Reading score 1. Write down and ask the patient to obey. Write down, close your eye, and patient will close eyes like this. So that means he's reading. Say what I am writing, obey that. You will write, close your eyes. The patient say, okay, he's obeyed your command. Actually, this is obeying the reading. Okay, so this will carry 1 mark. And then it is, can you pick up paper and write it for me? Write a full sentence for me. And he will be picking up paper and writing a full sentence for you, any full sentence. Okay, any sentence. I'm a man. It's a full sentence. That's it. And then the last thing in here is, can you please, this is, you need to understand that what it is. Can you please pick up the piece of paper in your right hand, fold into 2 places and back to the table. Twice, fold it twice. Pick paper, fold twice and put it back. 3, this is 3 tasks, 3 sequential tasks. Picking the paper, folding twice and putting it back. This 3 carry 3 marks. If the patient is picking the paper, not folding or not putting it back, it is 2 marks, 1 mark or 2 marks. Okay. And this is a bit like, I understand that this is like boring, but we have to do that. I am trying to make it like make you people to understand this. Last thing is you will say to the patient, please copy that. This picture, you will draw a picture, will ask this picture to copy it. That's it. Here it is 24% is normal, this is mild, this is moderate, and then it is never say it is dementia, never say Alzheimer, because Alzheimer is a different disease. Say mild dementia, moderate dementia, it's the dementia. You are actually scoring the dementia, not the Alzheimer, because Alzheimer is a diagnosis, not us. Here you are just evaluating. It can be dementia due to any reason, because with the history we can know about that Alzheimer disease, but until now it is dementia. Anything you want me to repeat regarding this? Other thing we are going to discuss about the dementia scenario. Anything which you want me to repeat, because this is, you just divide it into three. First task is like orientation, in which place, time and place, ask 5 and 5, 10 questions. Then you will be asking like a question regarding registration, attention, and recall. These are the 11 questions regarding that. 11 score, not 11 question. It's basically 11 score. Then the last thing you will be asking the 9 scores. And these notes will be given to you in a much better form, and it will help you a lot. Okay, ask about, before starting any MMSE scenario, ask about these questions. Never forget to ask these questions. Before starting these questions we have talked about, always ask, do you having any hearing problem? Can you see clearly? Can you read clearly? Can you write clearly? Because we are assessing her mental capability, not the writing capability, not her knowledge. Okay, so you need to ask these questions before we start. It is like bread and butter. You cannot forget to ask these questions as well. Okay, after the scenario is, ever do come with the mother some concern? No, oh, it's anorexia. I think the scenario is below. Okay, I'm going to give you the scenario of this. Don't worry. This is the scenario. This is the scenario. Number 2, acute medical unit, 70-year-old man found to be wandering in the park, brought by the police. Having the confusion, discuss the management with the examiner. This is, you will start this. Because is a patient with confusion, you will need to talk about his MMSE score. Okay. The other scenario is the dementia scenario. I just give me 2 minutes. I need to bring my charger because it's getting low. This is not the same MMSE approach scenario, because in this scenario you will say that I will do the mini mental state test examination, and he will give you the score. But the dementia approach is a different approach. I think we need to discuss this approach separately. So first of all, the scenario is that the patient, 65-year-old lady, presented with some concern, talk to the patient, address the concern. This is a dementia scenario. This is different, not MMSE scenario. We should have, it's a different approach. It's not the same approach. But you, in the end, you will say that I will be doing the MMSE scoring. The patient, examiner will give you the score that is 26, whatever. Okay, after doing that, you will be asking about PUPA, ask about the forgetfulness. What kind of things do you forget? Do you forget the names? Do you forget the loss of street? First of all, you need to ask, or you will be doing POOPA, PUPA. Why? Because since how long she's having, what kind of problem it is, what type of forgetfulness it is. Then you will be asking about, can you tell me, for open question will be, what can you please tell me more about that, before asking, okay, I'm forgetting things, can you please tell me more about that? Patient will be open to you. If not open, then you will be pointing out the things, because sometimes patient it is not in the conscious of the patient that I'm having the problem. Asking about this, asking about any behavioral change. Then you will be any behavioral change recently. Then what other question you will be asking about? You will be asking about problem with decision making. Doing problem with doing daily activities. Okay, these are enough questions for you to ask, because then you will going to asking about the Audipara, you will be asking this question, then you will be going to jump to the DD, because here the DD is quite important, because there are a lot of things which can cause dementia. You need to rule them all out. So for me, I would say, first of all, ask about depression, because the depression can cause dementia as well. Then you will be watching for the type of dementia, what kind of dementia it is, because there are a lot of things like Lewy body dementia, weakness in the body, memory problem. Do you have any weakness in the body? Is vascular dementia. Any weakness in the body, it is basically vascular dementia. Lewy body dementia is memory impairment with gait problem. So you will be asking about the gait. The question will be, do you have any problem with walking, any gait? Have you observed any change in your gait, in your walking? Okay, here you will be asking the problem of any weakness in your body. Then you will be asking the problem, any personality change. This we have already talked about. Then you will be asking problem with urine, any problem, and urine incontinence. Never assume that it is Alzheimer's disease. Never assume. Why? Because Alzheimer's disease is basically a diagnosis of exclusion, in which progressive dementia along with the family history are the most common factors. Otherwise, it is the discrete. Alzheimer's disease has no its own like particular things. All other dementia has its own particular thing. Then you'll be asking about headache and vomiting. It is the DD. Ask about an infection, because sometimes people, old age patient, get confused just because of they're running some infection. Never forget to ask about an infection. And what I would say, I would put this above after depression, even before depression. Because you cannot assume that it is Alzheimer's disease. You need to exclude all the causes. Okay. After asking all these questions, then you will be completing your DSC Holy family. In here, This area is quite important. Never underestimate this. Especially who do you live with, who is taking care of you, what do you do for a living, who is like responsible for you. Then you will be asking the DISA, because why alcohol can cause dementia. Okay, you will ask all these questions. And family history, why important? Alzheimer's disease in the family. So PMA Holy family is again important here. PMMA Holy family is again important. Then you will be asking about ICE. AIC is quite important here. This is again red. Why? Any idea? Because patient is not knowing what is going on. What's main query? Because I do forget the addresses. I don't know where to go. Okay, this is one of the concern. Then what is I for impact? How does this is impacting your life? This is again very much important. And last thing is like, have you done anything to cope with the situation? Yes, I am actually doing this, and I am memorizing this in this way. Why? Because why to say this? It is important because you will offer some management, and that she's already doing, and you are offering. That's not good. Again, after that, you will be asking red flags. Red flags are weight loss, lump bump. Okay. Then OET, you will be doing systemic examination, observation, you will be doing all that, and you will offer MMSE. You will offer MMSE. He will say, yeah, this is the score, but you will offer, okay? After that, you will say, after the examination, the early sign of dementia, and if he's saying that's a family history, this could be your mother is having dementia, this could be because of your dementia, is most probably, you will say most probably because of that. And here the important thing for you is, what you will do, you need to make the patient inside that this is lifelong condition. The rest of life, this is lifelong condition, you have to live with it. And how you will be doing so? Because you will say Alzheimer's disease is a condition in which we need to manage it. We can slow its progression. We can manage the thing, first of all, we need to make the progression slow. For that, I need to refer you with the memory clinic, in which they are going to put you on some medication such as memantine or other medication. However, you need to adapt certain lifestyle changes rest of your life so that to make things easy for you. So what is the basic treatment? For that, basic treatment is the medical treatment and lifestyle changes. What are the lifestyle changes you can offer? You can put some alarms. You want somebody should be with you, some carer should be with you. If the patient says like I can do my things on, you will again say to the patient, yes, that's perfect that you can do your things on, but in the future, if we do not work in the together and work in slowing the progression of the disease, the condition could be more detrimental. Okay, so you need tell the patient. So here again I come back. So saying the management, after saying that actually, but you have told me that you are having problem with forgetting the things, forgetting the dresses and certain behavioral changes. And you also mentioned me that you have the condition, your mother had the condition called Alzheimer's disease, the memory issues, she was having the memory issues as well. It seems like you are suffering from the same condition as you have started on symptoms. Okay, then for managing that, actually, I need to refer you with the memory clinic. They will be going to run some few more tests. Your CT scan, CT brain of your CT scan of your brain, and might be they are going to put you on some medication which will slow your progress. And we need to adapt some lifestyle changes, some lifestyle modification that will make your life easier. Would you like to hear about that? Okay, so as you told me that you are living alone, I would suggest that we can, I should refer you to the social services so that they can provide you with some carer. You need somebody to take care of you, and we can you can make the things easier for you. For example, you can put some alarms, some writing notes, so that you do not forget the easy things, and you can take the help of your family and friends. And how you will talk about that, because you have already asked about that. This is all about the management. And let me tell you that it is a lifelong condition. You will say that you need not to hide any condition. any situation, you will say that it is a lifelong condition, and you need to live with it. You need to learn how to live with it. What we can do is, with the collaboration with like yours and the medical team, we can slow its progress. Okay. Again, safety netting is similar for any suicidal thoughts and any self-harm things. Any students, anything? The lecture for today is over. If you want to ask anything regarding, we had almost today, we had studied 5 approaches in a day. It is 5 approaches in a day because MMSE scenario, it's very less likely to coming, but the other 4 approaches are very much coming. But I have seen it is coming. I have seen, I was there in UK in those days. There was a day in which it came. I don't know which day it was, but after my exam, it came in one day because my colleagues were taking the exam and one of them told me that it is coming. Anything, any question, please? You are free to ask any question.